to work and trimming it down to just a 15-minute visit.
The timing couldn't be better. In the next 10 years, there's a projected shortage of more than 130,000 doctors. Telemedicine was first created to help workers in remote locations like offshore oil rigs. Now companies like Mustang Cat in Houston are offering it to their employees.
Everything we do with the scope, the doctor sees on his end on a big screen.
Well, I think it helps patients tremendously.
We talked to Dr. Jones just like his patients do through the powers of telecommunication.
Talk to me about what it's like as a physician, because I understand you are able to even see better when whatever the body part might be you're examining is blown up on a big screen versus just seeing someone lying right here on this table.
Well, absolutely. If I were there in the little clinic examining you, for instance, looking at your ear, the vision I would see of your eardrum would be about as big around as the area of a pencil eraser, not much larger. Here, when I take a look at someone's ear, it's full screen size, and I'm looking maybe at someone who is in Indonesia, South Korea, off the coast of China, Australia. It's really amazing. I can listen to heart tones, lung sounds, look into throat.
David Aiken says he and many of his colleagues sure appreciate this medical service at Mustang Cat. Visits can even be scheduled during a quick lunch break.
When I'm down there on the clock, because I do have deadlines to meet, so for me to take a day off of work just to go and see a doctor for, 20, 15 minutes and having to sit there for maybe an hour to 2 hours to wait, versus just coming up here, making the appointment coming up here is very beneficial. So it was a pretty neat experience.
It really brings convenience. One of the great phrases in medicine is convenience drives compliance. People are much more prone to stay on care regimens, stay in touch with things like managing their weight and smoking cessation. These are things that the worksite clinics bring, and we're able to make those types of employee wellness initiatives, management of chronic conditions, and bring those types of things under physician supervision right to smaller workplaces.
We can do almost everything that a general practitioner's office can do. We can do flu testing, strep throat testing, we can do lab work. Some of it needs to be sent off-site, but we can do the lab taking. Blood work, we catch a lot of people that don't know they have problems because they're less likely to go to a doctor. So we catch high blood pressure, we catch high cholesterol, we catch pre-diabetic people a lot. We've even caught some skin cancer.
Privacy is of utmost importance too. No windows in the workspace clinic allowed. And they suggest patients use personal email and their own cell phones for added security. Medicine at Work is now helping corporations with at least 200 employees. Workers are able to use their own health insurance too, which is very helpful.